Hi, this is Dr. Shah again. I get the question asked again and again, what is BAT or Basophil Activation Test? So let's talk about it. Basophil Activation Test. So basophils are one form of white cells in our body, and their job is to store certain chemicals. When somebody has an allergic reactions, those basophils and related cells called mast cells get activated, and they release those chemicals. One of them is histamine. That's why when people allergic reaction, we use antihistamine. If it's severe enough, then obviously you use epinephrine. But those cells are in our blood. If we find a way to activate those cells with the food allergen, then it's called Basophil Activation Test. How do we use it? So let me explain a little bit. Now, if you have food allergy, you have been told by pediatricians, your local allergists, that you have food allergy. How did they make the diagnosis? They took your history, you had reacted to something. Then they did your skin test, they did your blood test, and in the blood test, they check for IgE. When IgE is high, usually patient is labeled as they're allergic to. But not everyone who has high IgE is truly allergic. Sometimes they have what we call hypersensitivity, or they're sensitized to that particular allergen. Now, how do we differentiate if someone has positive skin test or positive blood test is real? Either you feed the food and see what happens to the body. That's called oral challenge. But when you do that, there's a risk of a reaction, because if you do react, you may end up needing medications, including epinephrine. Or we can do that in the lab. That is Basophil Activation Test. We take the allergy cells, we put them together with the allergen, either peanut or milk or eggs or cashew or whatever food we have in mind, and you incubate them together and see what happens to the cells. If cells get activated with the food, then likely you are truly allergic to. It's also a functional assay. So we do multiple dilutions or multiple concentration of the food. So we also try to see at what level of the food the cells react to. So it's a very, very useful tool. The patients who have history of allergy but not very clear, or they have positive skin tests or blood tests, and we definitely need a proper diagnosis. This is the most accurate way to diagnose food allergy. So that's again BAT or Basophil Activation Test. I hope this was helpful.